Test 1 2. Test. Okay, I'm ready to begin. Thank you so much for your patience. Half a day? Oh my goodness, I think we could do a little better than that. Did we get our coffee this morning? I know, I'm sorry for letting you wait in the hot sun. Thank you so much again for your patience. Let's try that one more time. Half a day. Much better. That's what I expect from this particular group of stakeholders. Hafaday and welcome to the office of the Governor of Guam and Biba Betness. You are the first of many proclamations this morning, but we are here this particular time to proclaim November 2025 as Diabetes Awareness Month, and October 19 to October 25, 2025 as National Lead Poisoning Prevention Week. And we have a lot of stakeholders and dignitaries joining us this morning, starting off with the Honorable Joshua F. Tenorio, our Acting Governor of Guam. From the Department of Public Health and Social Services, Peter John Camacho, your Acting Director. Former Senator and Deputy Director for Public Health, Amanda Shelton. Also want to recognize the Committee on Health, Senator Sabrina Salas-Matanani. The Guam Diabetes Association, led by Scott Duenas, your president, and their officers. You can't miss them in their famous green uniforms. Yes, I do this every year. Scott Duenas, former mayor of Dededo, the honorable former mayor of Dededo. Let's give him another round of applause. The Diabetes Foundation of Guam. I see you, Gina. Half a day. Let's give a round of applause. The Guam Diabetes Control Coalition joining us this morning. Let's raise your hands, the coalition. Let's raise your hands. Where are you at? Guam Radiology Consultants. Where are you at? Yes. Guam Regional Medical City. Yes, along the wall. And the Department of Public Health and Social Services, I want to recognize. Yes, keep the applause going. For the Non-Communicable Disease Prevention and Control Program, this is the Diabetes and Tobacco Program. The Behavioral Risk Factor Surveillance System Program. Let's give them a round of applause. The Guam Comprehensive Cancer Control Program. The Guam Breast and Cervical Cancer Early Detection Program. The Northern and Southern Regional Guam Community Health Centers joining us this morning too. I also want to recognize from our territorial epidemiologist. Where are you? Soto. That's Soto. And Anne-Marie from our lab, our up-and-coming lab. We're very excited to open that lab next time, this summer next year. Also want to recognize Chief Public Health Officer Catherine Ancao. I didn't forget you. So like I said, we have two proclamations that we're here for this morning. And first, I want to give the floor to Peter John Camacho, our Acting Director of Public Health. He's going to talk about both diabetes and lead poisoning. Not at the same time. We'll do diabetes first. I think it's this side of the room with the green.
Those technical difficulties. Buenas and half a day. Today, as we proclaim November 25th as Diabetes Awareness Month, I want to speak plainly about the reality we face and the vision we must hold together for Guam. As a practicing diabetic, I know that too many families are living with diabetes, and too many are losing their health, their independence, and their lives to a disease that, while serious, is preventable and manageable. We cannot normalize more dialysis centers opening on our island. That is not the future that we want for our children and grandchildren. Instead, we must work towards fewer people developing type 2 diabetes, more people getting their condition under control, and all of us taking better care of our health. At the Department of Public Health and Social Services, our commitment is to move beyond words and action. We are advancing 4 key strategies that give us a clear path forward. Education campaigns. We are raising awareness about diabetes through media campaigns, reminding our community that prevention and control are possible and that action starts with knowledge. Clinical linkages. We are strengthening partnerships with health clinics to ensure that those living with diabetes are not left to manage alone, but receive high-quality care, regular monitoring, and timely follow-up. And my doctor always follows up with me. Diabetes self-management, education, and support, or DSMES. We will be providing programs for those already living with type 2 diabetes, equipping them with the tools, skills, and confidence to manage their condition every day and to improve their quality of life. The Diabetes Prevention Program, DPP. And for those at risk, Guam already has 2 proven lifestyle programs through Take Care and the University of Guam. And our department plans to offer one as well to prevent or delay type 2 diabetes through healthier eating, regular activity, and sustained support. This is the vision. Fewer hospital admissions, fewer amputations, fewer lives cut short. Instead, healthier families, thriving children, and a stronger island. But it'll take each of us, government, private sector, health professionals, schools, churches, families, to get there. As we recognize Diabetes Awareness Month, let us not only raise awareness, but also commit to action. Let us choose prevention. Let us support one another in management. And let us work for the day when dialysis centers are no longer needed to expand, because we have turned the tide against diabetes on Guam. And always remember that ounce of prevention is definitely worth the pound of cure. Thank you.
Invite you to speak on diabetes.
Thank you very much, Crystal. Thank you. Welcome, everybody. Happy Friday. It's so great to be with all of you. When I was preparing this morning to come in, I was just thinking about some of the outreach efforts I've seen, and I always see Mayor Scott with his wife and and I actually went to a station where he did do my blood test and take my blood pressure. My blood test was great. My blood pressure was high, as I knew. But those are very basic things, right, that we can do to empower ourselves and our families as we confront ourselves with this very, very real fact that prevalence of diabetes is much higher in Guam than in the rest of the United States. That is something that our island has been faced with now for generations, primarily caused by a dramatic change in our lifestyle and our diet after war. I always think that maybe during wartime when our grandparents, were malnutrition, that they wanted their kids to never starve, so they overfed them. And I kind of joke about that, but I'm kind of think in many ways that that's somewhat true. When people go through hardships, they always want to make sure that their kids and their grandkids don't experience it, and they over embellish, right? And just recently, when I was speaking to kids, I was more encouraged when I started. I was at a school and it was almost snack time, and when I was looking to see what kind of snacks, I thought that I might have seen a little less than what I was growing up with, right? Sometimes some of us, when we're going to school, moms and dads are packing them those lunch pills with all sorts of things that are out there. And part of the prevention side is recognizing that there are healthier choices with fruits and vegetables, fruits at least for the kids in the morning, and alternatives. And so we've seen some growth and progress. We see that in options now throughout the grocery stores and through restaurants on food consumption side. But on the other side of it, it has a lot to do with managing our lives. Making sure that we can reduce stress. Stress is a big inhibitor and enabler of some of the other health practices that can cause diabetes and some of the other NCDs that we're together battling. So this morning, we're gathered here to really give an opportunity for the public to pause, to recognize, to absorb the information that we have about trying to get on that prevention side, try to mitigate those that have diabetes, and also try and make sure that we have managed care for those that do. Try and reverse some of the trends, trying to get life extended past what the trajectory is. I want to recognize all of the folks on the front lines of this fight. There are many people in the government, in the healthcare community, and the volunteers, the community organizations that have come together to not only provide more information to our public, but to be more visible. When we go to schools, when we go to shop, when we go to the malls, having those intervention points, right? And it really helps when you have a cross section of the community. Normally, you might not stop at the section, but if you know somebody, you might are more than likely to go there. So when we have such a diversity in age, in socioeconomic status, in racial, in neighborhoods that we come from the island, we can bring in more people to help educate them and help them get those first screenings. I think a lot of people, those screenings are so effective. And let's face the fact, we have a lot of people that don't have regular access to health care. They delay. I know a good friend of mine, unfortunately, we lost him. He kept resisting going to the doctor. He didn't want to confront some of the things he suspected he had. But if he had gone, he would have known that the things he suspected he didn't have, but he had things he didn't know about. And that's the importance of the screening. So to everybody, thank you very much for your time and attention today. We're looking forward to your conference. Happy Feet, Mayor Scott was showing me. This is something very visible to everybody. Another early indicator about things that we need to do to intervene on the people that we work with and the people that we love. Si Jus Masi and happy Friday.
Thank you so much, Lieutenant Governor. And speaking of education, I do want to shout out to my friends in the back. Take care. I didn't recognize them earlier. Let's give them a round of applause. Working on the education front, you do see their pieces in the newspaper and in the media. So thank you so much for that educational piece. Without further ado, I want to give now the floor to Scott Dueñas, former Dededo Mayor and President of the Guam Diabetes Association, for the reading of the proclamation for diabetes.
Good morning. I'm going to call everybody and see if you're here. Okay. Okay. We'll go ahead and do the reading here. This is Proclamation number 2025-102, a proclamation of the Governor proclaiming November 2025 as Diabetes Awareness Month. Whereas every November, Guam joins the nation in observing Diabetes Awareness Month to educate the community about diabetes, including type 1, type 2, gestational diabetes, and prediabetes. Promote prevention through healthier lifestyle and support those living with the chronic disease. Whereas November is recognized across the United States and National Diabetes Month, and November 14 is observed as Global and as World Diabetes Day, uniting Guam with the nation and international effort to raise awareness and promote prevention of this chronic disease. Whereas diabetes lead to serious health complications such as heart disease, kidney disease, vision loss, adults with diabetes are 2 to 4 times more likely than those without diabetes to die from heart disease and or suffer from a stroke. Whereas the risk factor of poor diet, physical inactivity, and other lifestyle behavior increase the risk of diabetes and related complications. Our island has seen a significant rise in the number of adults diagnosed with diabetes, which is a primary contributor to 2 of the 3 leading causes of death on the island, heart disease and stroke. Whereas according to Center of Diabetes Prevention and Control 2023 Behavioral Risk Factor Surveillance System, Adult Survey, and Guam Office of Vital Statistics of 2023, top 10 cause of death, diabetes is the 8th leading cause of death in Guam, with the prevalence rate of 16.4%, approximately 39% higher than the U.S. average of 11.8%. Whereas the Guam Diabetes Association, the Department of Public Health and Social Service, the Guam Diabetes Control Coalition, Diabetes Foundation of Guam, the Non-Communicable Disease Consortium, and many other public and private organizations are committed to continuing the substantial effort to support those struggling with diabetes through diabetes self-management education, support, whereas on November 9, 2025, the 26th Annual Guam Diabetes Association Conference will be held to raise awareness of the disease with the theme, Happy Feet, the Nerve of Diabetes. Whereas managing blood glucose, blood pressure, cholesterol level, taking medication as prescribed, having regular doctor's checkup, and maintaining a healthy lifestyle through balanced nutrition, physical activity, hydration, and proven ways to prevent or control diabetes. Whereas our island recognized Diabetes Awareness Month, we stand with those diagnosed with diabetes and prediabetes. We recognize the numerous organizations, agencies across Guam that are dedicated to combating this diabetes and providing the necessary education and support to improve the life of those struggling with it. We recognize family support is positive association with improved self-management can lead to better health outcome.
Now, therefore, I, Joshua F. Tenorio, Octu Magatlahin Guahan, Acting Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim November 2025 as Diabetes Awareness Month. Given under my hand, I cause the Great Seal of Guam to be affixed here in the capital village of Hagåtña on this 17th day of October in the year of our Lord, Anno Domini 2025. Biba Diabetes Awareness Month.
Viva! Jesus Masi, Mayor Scott, for that reading, and to our acting governor for signing the proclamation. We'll now move on to proclaiming October 19 to October 25, 2025 as National Lead Poisoning Prevention Week. Resetting now, I turn back to our acting director for the Department of Public Health and Social Services, Peter John Camacho, for his remarks.
Thank you, Crystal. Good morning, and thank you for joining us. Acting Governor, distinguished guest, Senator Salas, Matanani, welcome. Today we proclaim October 19th through the 25th, 2025 as National Lead Poisoning Prevention Week. It's a time for us to come together as a community to raise awareness, strengthen partnerships, and renew our commitment to protecting our island's children from the dangers of lead exposure. I'd like to begin by recognizing our partners who make this work possible. The Pacific Island Health Officers Association, Guam EPA, the Guam Department of Education's Head Start program, the Guam Housing and Urban Renewal Authority, and the dedicated teams from the Department of Public Health and Social Services who continue to lead the charge in environmental and child health protection. Lead poisoning is one of the most preventable environmental health threats facing our children today. Yet it remains as one of the most persistent. We know that no amount of lead is safe in the human body, and even small exposures can cause lifelong effects on learning, behavior, and development. Here on Guam, our unique island environment presents both challenges and opportunities, from aging infrastructure and imported goods to traditional practices and certain occupational exposures. We know that the risk of lead exposure can touch many corners of our community. But the good news is that lead poisoning is 100% preventable, and prevention starts with awareness, education, and testing. Over the past year, we've made meaningful progress through the Guam Childhood Lead Poisoning Prevention Program, which continues to identify risks, support families, and work closely with schools, child care centers, and healthcare providers to ensure that no child is left unprotected. But we know that this effort cannot stop here. It takes a united front, again, government agencies, parents, educators, healthcare professionals, and community leaders working together to keep our homes, schools, and neighborhoods safe. National Lead Poisoning Prevention Week is more than a calendar observance. It is a call to action. It is a reminder that the health and future of our children depend on the choices we make today. To test, to educate, to intervene early, and to build a safer Guam for generations to come. Thank you for being part of this shared mission and for standing with us in protecting Guam's most valuable resource, our children. Thank you.
Thank you so much, Acting Director. I now want to give the floor to our Acting Governor of Guam, the Honorable Joshua F. Tenorio.
Thank you very much. This effort, really, I want to recognize Guam Department of Public Health and Social Services, and actually the regional approach to recognizing and reacting to the cause of lead poisoning and early identification. Within the last year, the governor and I have promulgated some executive direction that provides further assistance to public health and social services in concert with the Guam Department of Education and the Guam Waterworks Authority, recognizing and focusing resources on testing and making sure that we understand what all the mitigating efforts there are to improve infrastructure at schools across the island, and also to institute a lot of surveillance testing. This effort really is something that many people don't realize. Lead poisoning normally is something that you would think of in the 80s and 90s and the 70s, but still remains throughout the world a prevalent issue that continues to need focus. So this morning, we recognize that effort. We recognize that there is active work that is occurring throughout the island and across the region, understanding also that that the island as a major migration point also is a place where we arm and recognize and activate our healthcare system to respond to these occurrences when they come up. So just for the public to know, this continues to be a priority of not only of our administration, but a specific program objective of the Guam Department of Public Health and Social Services. And I want to recognize the department for their coordinating leadership on this effort. Sijus Masi.
Thank you, Acting Governor. And now for the proclamation reading, I want to give the floor to Catherine Ancao, Chief Public Health Officer.
Thank you, Krista. Thank you, Acting Governor. Proclamation number 2025-103. A proclamation of the Governor proclaiming October 19 to October 25, 2025 as National Lead Poisoning Prevention Week. Whereas lead poisoning is a serious but preventable environmental health problem that can affect people of all ages, with children under 6 years old being especially vulnerable to its harmful effects on brain development and growth and behavior. Whereas even low levels of lead in a child's blood can cause learning difficulties, developmental delays, hearing problems, and other lifelong health impacts. Whereas the primary sources of lead exposure include lead-based paint, contaminated soil, household dust, and certain imported products such as pottery, toys, and cosmetics. Whereas the Guam Department of Public Health and Social Services, through the Guam Childhood Lead Poisoning Prevention Program, works to identify, prevent, and reduce lead exposure in children through education, testing, and community outreach. Whereas parents, caregivers, health professionals, and community leaders all play a vital role in protecting children from lead exposure by promoting testing and taking action to eliminate lead hazards in homes and the environment. Whereas National Lead Poisoning Prevention Week provides an important opportunity to raise awareness about the dangers of lead exposure, encourage blood lead testing for children, and promote preventive measures to keep families safe. And whereas through community engagement, education, and proactive public health initiatives, Guam reaffirmed its commitment to ensure that every child has the opportunity to grow up healthy and free from the dangers of lead poisoning.
Now, therefore, I, Joshua F. Tenorio, Octu Magetlahin Guahan, Acting Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim October 19th to October 25th, 2025, as National Lead Poisoning Prevention Week here on Guam. Given under my hand, I cause a great seal of Guam to be affixed in the capital village of Hagåtña on this 17th day of October in the year of our Lord, Anno Domini 2025. Viva Public Health.
Viva. Thank you, Ms. Catherine, and thank you, Acting Governor. I now want to call everyone to the front for a group photo. Oh, so you're good? Yes, those along the wall, please, in the back, please join us in the front. I understand we have a lot of overlapping stakeholders, and many of you will also be here for our 11:30. Shirley, you're part of this group?